What you think about COVID-19 vaccines in the black community?
The COVID-19 vaccine.
Vaccines. Obviously, the African American community has a history of just like not trusting any government-led medical advice or any type of thing like that, just because of just history. But I feel like, hey, if you feel like you want to get it, go get it. If you don't, then don't.
What I think about healthcare in the black community in general is that we need more information and more transparency.
Well, to be very honest with you, since science has been my field, all my life, I believe that taking the vaccine is better than not taking it.
I think that the black community is very mistrusting of the COVID vaccine for very good reasons. There's been a history of vaccines being used to run trials on people of our community, and we have very good reason to be mistrusting of the medical system.
The one comforting thing that I do have is not that they take this black woman who is a scientist that has been a central or major part of this work regarding the vaccine and put her as a face. That's almost like tokenism and just taking this person like this is going to get that vote. I'm not looking at it and considering it because of her. I'm only doing this because I actually have friends that are a part of this work that I do that are working in that. 2 sisters and that work in this. And these 2 sisters have given me some insight.
We know the history of the government with the black people with vaccines.
Black people, we don't get the same deal as everyone else. Like, you have the COVID vaccine and the way that they're handing it out, and the income, the neighborhoods that have higher incomes is not the same as how they're distributing it in the black community, and that creates distrust. And we already know that they've experimented on us and things like that.
Vaccines in the black community is a very touchy subject because inherently so the black community is distrustful of the medical community because of things like the Tuskegee experiment, things like stealing organs, people dying in hospitals and things like that.
I just want us to just take a minute and forget about, not forget, let me take that back, not forget, but just get past the Tuskegee experiment. I don't want us to be the least and the last to be vaccinated.
When I think of the COVID vaccine, the first word that comes to mind is unclarity. Basically, all the information about it is being put out in the media, put out into news about this vaccine that just came out the blue that is supposed to help contain or do whatever the effects of COVID, but we're being pressured into taking this vaccine when everything's opened back up. It feels like everything else except for the vaccine that's been put out to put restrictions on COVID is like being uplifted.
With that being said, I just need for the vaccine to be out a little longer before I actually decide to take it.
What I think about the vaccine is that there hasn't been enough studies done within our community that would give our people a sense of urgency to go and take these vaccines. We know how the health system has not been fair to black communities as far as it relates to having underlying health issues or access to health care. That's probably the biggest issue that we face within our community, is having access to quality health care.